Esteemed colleagues, we'd like to launch our educational workshop, and with a welcoming word, I would like to give a floor to the head physician of the clinic hospital number 122, the head of the ENT and ophthalmology department of the St. Petersburg University, to Professor Yakov Nakatis. Esteemed colleagues, good friends, I'm glad to greet you here in our clinic, and today we'll continue with our training programs, which we pay great attention to and which are very important for us. In our clinic we have lots of modern equipment. Today in the clinic we see the change of generations. Our clinic was created many years ago, and everybody who came those days, even 10 years later, actually they reach the age when they can share their knowledge and skills with the young ones. Without additional programs, it's impossible. Every day in our clinic we have an educational process. We have 9 different departments, but mostly they're involved in surgery, the endoscopy and individual surgery. Today in our clinic they are a priority. They have a leading priority role. It's of course the merit of the specialist and the companies providing the equipment. On one hand, it's quite easy to have some money and to choose what you need, but on the other hand, today the healthcare is not poor. It's well funded, but you can't have enough of money, and the appropriate and rational use of those money actually depends on on the skills of your specialists. Because those machineries, those equipment we purchase, it sees everything. It's those heavy X-rays and imaging tools and equipment. They can see everything, but if the specialist can or not interpret what the equipment can see, that's a big issue. And no trainings on dummies. Of course, they give some result, but they cannot provide you the final answer. And the communication, the live communication, that's what we need to develop skills of the surgeons and diagnostic specialists. I would like to say that our clinic is actually we are today in a very unique situation. Our clinic, the clinic is today our staff, the staff of the endoscopic unit, with their activity, with their skills, with their desire to advance, they have proven that they need this equipment, that they need those machines, that they need those tools. We buy those tools in most of the cases, but part of the equipment is provided for us to try by Olympus, and we are really thankful to them for that. You will see today everything you need. I'm sure you'll have lots of questions, and I'm sure that this workshop actually will be of a good result, of a success. Don't pay attention to this room or another room. I know that they have such a superb furniture. The most important that we have a great operating theaters, great tools, and you will see great specialists demonstrating those tools. And I would like to wish you a great working day. Thank you.
Dear colleagues, please allow me to pass the floor to the head of the chair of dietology and GI, to Professor Baranovsky. Dear colleagues and friends, it is wonderful that we have this opportunity to come together, specialists of absolutely different fields, and discuss very important problems of pancreatology and biliary pathology. Medical science is constantly under development, and at the moment we are discussing new diagnostic and treatment modalities and new technologies, and we have an opportunity to share our vision on the new approaches and also to have new information and study how to use these new diagnostic and treatment technologies. We have great opportunities here in St. Petersburg, and we do use them. I mean, on the mutual work or common work of internalists and surgeons. And at our university, we have a very good tradition of exchanging specialists in sort of educational format. Viktor Kashenko is a lecturer at our chair at our university. He has been working along with us, and also we can name the school of Professor Borisov, and at the moment Professor Kashenko has his own school. And we definitely can say that such seminars and such lectures for GI specialists cannot be overestimated for the practical implementation. And us internalists will also have a lot to say, because surgeons do not always demonstrate the in-depth knowledge in rehabilitation of patients in anti-relapse treatment. And today we're going to discuss a great number of issues related to these problems. So it is very pleasant to me that in my city, in this particular medical establishment, having vast experience and very prominent establishments, we organize such seminars where we can not only demonstrate ourselves but also to learn from our foreign colleagues, exchange opinions. And I do wish all of us very fruitful work, very positive day, or days even, and great experience in exchange during our conference. Thank you. Dear colleagues, before we move on to the body of our seminar, I would like also to say a couple of words on how the seminar is going to be organized. It is going to be to comprise 2 days. Today we shall be discussing theoretical issues related to the pancreatic gland disorders, and tomorrow we shall focus our attention on the biliary tract disorders. But at the same time, the theoretical lectures will be interrupted by surgeries, and we shall see how our surgeons, our colleagues, will operate on patients in real time. That is why you will have an opportunity to ask questions during the surgery demonstration. You can also ask questions. Please do not hesitate to do that. And it will be also very useful if we have lively discussion. We would like to have a very friendly and amicable atmosphere, the atmosphere that usually is here in clinical hospital number 122. Because this is exactly the atmosphere within which we can discuss our clinical issues, and we should discuss the content first and foremost, not concentrating on the format and on the protocol. And the main thing is to see into to look into the problem from different angles and perspectives, because we're going to have to listen from GI specialists, from endoscopists and surgeons, pathomorphologists, and thus we will have an integral view over the disorders and problems that we come across at the moment. I mean, every one of us in our routine practice. At the moment, of course, the number of disorders grow, and we cannot classify them as internal disorder or surgical type of disorder. And we must have this multidisciplinary approach to not only to diagnostics but to the treatment of these type of disorders, and we need a team of specialists who would be thinking about the diagnostic approaches and the treatment modalities. At the moment we have new methods, new algorithms, and in order to keep track of this dynamic situation, we set up such type of educational programs and seminars and workshops where we can work out one single strategy and one single approach.